My name is John J. Bartolozzi, MD, cardiovascular medicine. I'm a invasive and interventional cardiologist, which means I can do procedures such as putting coronary artery stents in, stents in the periphery and the peripheral arteries. I also do pacemakers, defibrillators, and cardiac resynchronization therapy, which is a biventricular pacemaker. I did medical school at Southern Illinois University School of Medicine in Springfield, Illinois, which is my hometown. Also did my internal medicine residency at SIU in Springfield. And while I was there, I was involved in clinical research, in door-to-needle time in treating heart attacks with clot busters, and I was part of the publication of that study. Then I did my fellowship in cardiology at the University of Missouri in Columbia, Missouri, and there I also was involved in clinical research. I was the Timmy IV fellow, and I looked at different blood clot buster medications, which ones were quicker, which ones kept the artery open and clear. And I did a lot of interventions as a result of that. We enrolled over 160 patients in that trial. And so I did a lot of interventional cardiology as a result of that. I also published that trial. I was part of that trial, so I was published. I also wrote another paper of my own as a result of that trial. So I have a lot of clinical research experience and publishing. I have been in Enid 25 years. We opened the practice back in February 2000. And altogether, I've been practicing cardiology for 31 years. I started out in Missouri and then actually moved here because a friend of mine recommended Enid as a place that was in need of cardiology. And so I was happy to come here and establish a practice, build a practice over the last quarter century. We've raised our family here. We have 2 boys, and one actually did training at the Advanced Air Force Base, and he's a captain in the Air Force. And then our second son he's a senior at OU. And so I've been at St. Mary's since I've been here, since 2000. I've been part of the staff for 25 years. Cardiovascular medicine is exciting from a research point of view because there's so much that can be contributed, as I have done in my career. I've even published since I've been here in Enid. And it's just the heart and the cardiovascular system has always fascinated me, how it works, how it doesn't work, and how I can fix it. And that's what I really enjoy. Hands-on, being able to open up blocked arteries, whether it's the heart or the legs, or keeping people's heart beating with pacemakers or defibrillators. Our patients we treat them like family. My nurse is a registered nurse, cardiac nurse. We're married, and we have worked together for 30 years. We like the patients to feel comfortable in a home atmosphere, and because I enjoy, as much as I can, I enjoy getting to know the patients, not just on a professional level, but if there's, on a personal level, sometimes if there's things that they like to talk about, and I have time, I'm happy to join them in conversations about those types of things. So it's the patient interaction that is, to me, the most important part of what I do. Well, my wife and I, we do like to travel. With our son being in the Air Force, we have gone out of country to go visit him. As far as hobbies, I'm a little eclectic. I am a part-time musician. I do find time to play in a couple bands here in town. We play around the area locally, and that's my hobby. I've been playing guitar since I was a little kid, and so it's just it helps to keep me sane in what can be an insane world.